Dear students and YouTubers, today I will be giving you a short glimpse of the condition pneumothorax. It's very important topic as regards medical emergency and as regards your viva examination. What is pneumothorax? Pneumothorax is abnormal collection of air in the pleural space. Pleural space is the space formed by two layers of pleura, parietal and visceral, and there occurs abnormal collection of air in the two spaces, that is known as pneumothorax. This is outer layer. Visceral layer is attached to the lung. So when there occurs collection of air in this space, it is known as pneumothorax. This pneumothorax is of various types, that is primary, secondary, traumatic and tension pneumothorax. Primary pneumothorax occurs when there is no visible cause for the condition. Usually it is because of the rupture of congenital emphysematous bulli. So that may rupture because of any reason and that may lead to spontaneous pneumothorax. Secondary pneumothorax is because of the underlying causes like COPD, pulmonary tuberculosis, lung abscess and bronchitis. But before going further, I will request you to go to my app from the Google Play Store, Dr. Ashok Kumar Rana, and download it, and you will find various other topics in my Class Plus app which you can purchase from the site. So after secondary, third is traumatic. It is usually because of roadside accidents which may lead to rupture of the ribs, then blast injuries, penetrating injuries and iatrogenic due to certain procedures which are done in the chest. For example, in patients of pleural effusion, when we take out fluid by aspiration, there may be accidental entry of the air during that procedure, that is known as iatrogenic. Then fourth is tension pneumothorax. It is a valve-like pneumothorax. There occurs small valve-like structure becomes at the lung level that leads to collection of air in the pleural space, but it will not allow, this valve will not allow the air to come out of the pleural space. So that is called tension pneumothorax and it is a very serious emergency. So various clinical features of pneumothorax are pain chest, shortness of breath, cyanosis, and there is presence of general ill health of the patient at the time of presentation. On examination, you will find cyanosis. Tip of the tongue will be blue, nails will be blue, and mucosa of the mouth will also be blue. Central cyanosis will be there. Then the trachea may be shifted to the opposite side if the pneumothorax is massive. Usually some of the trachea is toward right side, normally placed, but when it is more on the right side, that means the pneumothorax is on the left side. And similarly, on palpation, you will find the apex beat of the heart that will also be pushed towards the lateral side. That indicates that the pneumothorax is on the right side. If the pneumothorax is on the left side and the heart is pushed towards the right side, that is known as dextrocardia. So on percussion note or percussion of the chest, the percussion note will be hyper-resonant, and on auscultation the breath sounds will be absent on the side of the lesion, and on the opposite side the breath sounds will be present, and there may be findings of the underlying disease like bronchiectasis, COPD and lung abscess if there is disease of both the lungs. Similarly, vocal resonance will be absent on the side of the lesion. The investigations, the prime important investigation is X-ray chest that will show the collapse of the lung towards the central side and filling up of the whole of the pleural cavity by radiolucent presentation. It is because of the air. There will be marked or clear cut border of the lung on the, because of the collapse of the lung on the side of the lesion. Then arterial blood gas analysis will show there will be increase in the CO2 levels and decrease in the oxygen levels, that is hypercapnia and hypoxia. So treatment or management should be immediate in patients of spontaneous or tension pneumothorax, where we have to put the needle immediately before going even for any investigations. If you don't have, a patient comes to you at midnight, you don't have anything, just for after examination, percussion note is hyper-resonant, you put the needle, 20 gauge needle, that is 20 gauge needle, मोटी वाली needle डालनी है in the second intercostal space. If the pneumothorax is on the left side, if it is on the right side, then on the right side. You put the needle immediately and air will gush out from the needle, and then after some air comes out, you put a syringe on that needle and then connect the needle with the tube, and that tube is connected with water seal. Water seal is when you put the tube coming from the lung underneath the water level. This is water level, this is bottle. It has two openings. One is inlet through which air is coming from the lung, pneumothorax. It will go like this, and from the water it will come out into the atmosphere. So this is called water seal, because water has sealed the incoming air from the atmosphere. If there is no water, the air will come from this side to again back to the lungs. So it is very important that this part of the tube should be under the water level, underneath water. So this is called water seal. And then when the patient has shown improvement, you start finding out the cause of the pneumothorax, and according to the cause of the pneumothorax, treatment of the condition is to be done. So that's all for pneumothorax, and I hope you will like it. It's a small topic, but it's very important medical emergency, and most important is how to manage it. You must know what is water seal and how to do the aspiration of the air from the pneumothorax. So that's all for today. Thank you.